Hi, I'm Irene,
And I'm Sophia.
and we're here to talk to you about discharge medication counseling, sometimes referred to as medication therapy management or MTM.
One of the most important roles of a licensed pharmacist is patient counseling. This is a one-on-one interaction between a patient and their pharmacist. Counseling is beneficial to both pharmacists and their patients. For pharmacists, this acts as a double check to ensure that the patient has received the proper medications. And for patients, this might be their first time they're being educated on their medication.
Most patients being discharged from the hospital will receive prescriptions to be filled, and some lack the proper counseling on the integration between their new prescriptions and their old prescriptions. Educating patients on their medications is key to adherence, so it is absolutely essential a patient understands why they are taking their medication. Hospital readmissions have proven to be lowered when a patient receives counseling by a pharmacist prior to being discharged. With education, a patient is more likely to be successful.
I know it's still new to hospital pharmacists to counsel patients prior to discharge, but that's why we're here today. By being part of the healthcare team, pharmacists have a unique opportunity as the medication therapy expert to impact the patient's well-being after they've been discharged.
So let's start by showing you an example of how you should and should not perform patient counseling. Pharmacy, this is Irene speaking. Discharge counseling? What room number? Okay, I'll be right there. We don't have time for this.
Good morning, pharmacy. This is Sophia, the pharmacist. How may I help you? Discharge counseling? Okay, what's the patient's PIN number? And when are they getting discharged? Do you know if they have any specific questions? Alright, I'll be up there in about 20 minutes, but before I go into the room, I'll make sure I check with you. Okay, thank you. Bye.
Mrs. Smith?
Yes.
I'm here to talk to you about your medications today. It's going to take about 15 minutes. You are Jane Smith 9776, right?
Yes.
Okay. You're going home with insulin detamir, okay? So you know this medication is for diabetes, correct?
Yeah, this is my first time using insulin. I used to use metformin.
Okay, so your doctor told you to inject yourself with 55 units daily, right?
What? Wait, what is this? Insulin what?
Insulin detamir.
Hello, Ms. Smith.
Yes.
Hi, I'm Sophia, one of the pharmacists here at Southwest Healthcare System. I'm here to go over your medication that we're discharging you with today. Is this a good time?
Yes, it's a good time.
Okay, let me just make sure I have the right person. Can I get your full name and date of birth?
It's Jane Smith, 9776.
Okay, so it looks like you're going home with insulin detamir. It's also known by its brand name, Levemir.
Alright, so what did your doctor tell you to expect?
He didn't tell me anything.
Oh, that's okay. Doctors hardly spend any time with their patients, and pharmacists are the medication experts, so you're in good hands. So basically, you want to inject yourself 55 units daily right here, and there might be some irritation where the site is given, and you might experience some hypoglycemia.
What?
Okay.
What did your prescriber tell you this was for?
He said it was going to be for my diabetes. I used to take metformin.
Okay, so this is an insulin that will help you lower your blood sugar. And how did your prescriber tell you to take this medication?
He told me to inject 55 units into my belly.
Okay, yeah, you are injecting 55 units every day. And make sure you do it around the same time every day. And you want to move the site where you give your injection each time. And this is given into the fatty part of your skin. So that can be your belly, or behind your arm, or behind your thigh. Does that make sense?
Yes, it does.
So if your blood sugar falls too low, you want to prevent that from happening by taking those like little strips and putting it in the machine. It's not that hard. And then if you can't do that, you can just have your physician do that for you, okay?
What did your doctor tell you to expect from this medication?
He said it's going to lower my blood sugar.
Okay, so yeah, it should definitely do that. And it might give you some irritation at the site where you injected yourself. What you want to look out for is if your blood sugar falls too low. When that does happen, you might experience dizziness or blurry vision, and you might even faint. But what you can do when that does happen is take like a fast-acting sugar, like orange juice or a
Okay.
Coke.
And then you want to keep open vials in room temperature for 42 days, and then the ones you haven't opened, you keep in the fridge for 42 days.
Do I keep this in the refrigerator?
Yeah, you can keep unopened vials in the refrigerator, but open vials you can keep it in the refrigerator or at room temperature. But make sure you throw away any open vials or unused vials after 42 days. And you want to throw away your needles in a sharps container as well.
Where do I get a sharps container?
That's a good question. I can look that up for you. Do you live in the area?
Yes.
Okay. Be sure to call around, and then I'll come back with that information.
Days as well, and then if you miss a dose, you want to take it as soon as you remember. But if it's close to your next dose, you want to skip it and then go back to your regular time. You don't want to take 2 doses at the same time, okay?
This sounds like a lot of work to me. I don't want to inject myself.
Okay, well, do you know what to do when you've missed a dose?
No, he didn't say.
Okay, so if you miss a dose, make sure you take it as soon as you think about it. But if the time is too close to your next dose, you want to skip that missed dose and then return to your normal schedule. You don't want to take 2 doses or any extra doses.
You weren't adherent to your old regimen, and now you're in this situation, and you clearly don't care about your health. I mean, you're eating Doritos, you're eating Twix, and you don't want to lose your foot, right?
No,
Okay,
I don't want to
so-
lose my foot.
Okay, so take that Twix out of your mouth, and you better be adherent with your insulin regimen. So here's a medication packet. You can go ahead and read that when I leave, and all right. So I'm gonna get going.
Can you get me a cup of coffee?
Oh, you can ask your nurse. That's not my job.
So I know that was a lot of information for you. I do have this printout about the medication and what you should expect from it.
Oh, good. Thank you so much. I'll read this later.
Okay, do you have any questions for me?
No, can you get me a cup of coffee?
Okay, I could definitely ask your nurse on my way out and have them bring that in for you. Anything else I can
No.
help you with?
No, not at this time.
Okay, well, if you do think of any questions, you can ask your nurse and they can give the pharmacy a call, and I can always come back and answer any questions you might have.
Oh, good.
All right, Rob. Thank you for your time.
Thank you.
So I hope you enjoyed our good and bad scenarios.
And next, we'll be going over the do's and don'ts to keep in mind when counseling your patients.
So here's a list of things to do while patient counseling. You want to research the patient and the drugs to be counseled on, see if there are any therapeutic duplications, missing therapy, drug-drug or drug-disease interactions, or any contraindications to therapy. Check with the nurse before counseling the patient. See if it is a good time to counsel the patient and if there are any barriers to communication that you should be aware of. Use hand sanitizer when entering and exiting the patient's room. Introduce yourself and explain that you're there to go over their medications with them and to answer any questions. Ask if the patient wants counseling. Verify the patient's name and date of birth to see that you have the correct patient. If the patient has guests around, ask the patient whether it is okay to talk in front of them or if you should return at a later time. Evaluate the patient's mood and interests and establish a relationship with the patient. Engage in a dialogue versus a lecture and find any barriers to medication adherence that the patient might have. Verify the patient's knowledge and understanding by asking them a question so they can repeat back to you to see that they understood. Then ask the patient if they have any questions or to clarify any misunderstandings. Use patient-friendly terminology, like saying high blood pressure instead of hypertension. Then you want to be an active listener, be cognizant of nonverbal cues, and be ready for questions. Lastly, be comfortable when you don't know the answer to a patient's question and ask if you can get back to them.
Now, the don'ts of patient counseling. You don't want to use medical terminology such as hypertension. You don't want to use close-ended questions. Don't counsel your patient without doing your homework first. Don't lecture the patient. Always engage in active conversation. Don't counsel patients if they don't want to be counseled. And don't just rely on the medication reconciliation on the time of admission because they could be on other medications that you were unaware of at the time. As pharmacists, being active members of the healthcare team, we play an important role in providing counseling to improve compliance and therefore therapeutic outcomes and improving the quality of life.
So with everything we went over today, keep in mind that every patient scenario is different. Just remember, practice makes perfect. Ding!
Because you don't want to take two at once. All right?
This is too much. I don't understand. I'm not going to remember this. I can't inject myself.
Sophia.
And we're here to talk to you about discharge medication. Can we just talk? Okay. I'm sorry.
Or a handout. I was almost going to say the pharmacy student Sophia gave this to me.